one of the reasons the health care reform bill is in trouble right now is because the American people have figured out that there are obviously things in that bill that just don't add up. It doesn't make sense to say to people, you can keep everything you have, nothing is going to change, we're going to add a whole lot more people to the insurance, we're going to reduce costs in Medicare by 500 plus billion. It's not going to cost you anything and nothing will change. People just don't buy it. It's so clearly not true that you can do all those things at once. And that's why I think, in my experience, what I've learned is the way you solve complex problems is not try to do everything at once. It's not to try and boil the ocean. It's not to try and come up with the perfect solution that satisfies absolutely everybody at the same time, because that's impossible. The way to solve complicated problems is to start somewhere, to start with the clear, obvious things that are going to make a difference. And these are two things that will make a difference. We also know, by the way, that in places where doctors practice integrated care, quality goes up and cost goes down. So let's look at how we encourage that approach more broadly. Another very obvious thing we need to do to lower the cost of health care is to focus on medical malpractice reform. We know, the data is very clear, that when medical malpractice suits go out of control, the cost of health care goes up. And this is a place where California has actually made great progress. There has been medical malpractice reform here in California. It has made a dramatic difference in the cost of health care. Let's take that lesson and apply it more broadly across the country. It's not right that people can't get insurance because of pre-existing conditions. We ought to solve that problem for people. We can create a subsidy so that no one can be denied health insurance because of a pre-existing condition. But that simple step would be far more effective and far less expensive than the huge health care reform bill that's being debated now. One of the things that really concerns me about the debate in health care reform right now is when people start to say, well, the way to reduce cost is to limit the number of tests that a patient can receive. The truth is that if you don't receive the right diagnosis, you won't get the right quality care. Our emphasis should be on ensuring the highest quality care. Frequently, the highest quality care is also less expensive, but let's start with what is in the best interest of the patient. In my own case, had I not been able to get a whole series of diagnostic tests, we would not have known that I had breast cancer, and I could not have gotten the right treatment.